Hello friends, welcome to the channel. Today we will be discussing about a very common disease or disorder of the eye which we very often find in eye OPDs, that is cataract. Okay, so what is cataract? Cataract is an opacity within the eye's natural lens, leading to blurred vision and decreased visual acuity. Right? The prevalence is high, especially in the older adults. So, for understanding cataract, let us first understand the anatomy of the eye. So, over here we can see in the first picture, the eye on a gross basis is divided into the anterior compartment and the posterior compartment. The lens is present in the anterior compartment. Okay, so the anterior compartment starts right from cornea and ends up to the back of the lens. Now this anterior compartment is again divided into anterior chamber and the posterior chamber. Right, the anterior chamber is from the starting of the cornea up to the lens, and the posterior chamber has the lens and the posterior capsule of the lens. Right, so this is the anterior chamber and this is the posterior chamber, and behind the posterior chamber is the posterior compartment which extends from the back of the capsule, posterior capsule, to the retina at the back. So this is the anatomy of the eye. Now the lens is held just behind the iris, right, and in front of the posterior capsular bag. Right, now this is the natural lens. Now this natural lens is transparent in nature, so the light will pass through the lens and will form an image on the retina. So in this way the person can see the image, but as the with aging or because of various factors, there can be deposition of proteins over here, right, on the lens, and the lens will become whitish, it will become opaque, so the lights will not properly travel and fail to form image on the retina. So there's blurred vision. Like this one is the normal eye, the lens is clear, but here the lens has become opaque, and as a result, this is cloudy. So this is the cataract condition. Okay. So now there are different types of cataracts depending upon how the lens has been changed, right? It could be a nuclear cataract. So nuclear cataract means the opacification has started from the nucleus of the lens. Now we should also discuss that the lens is actually a spherical structure, not spherical actually, but circular, and it has an outer coverage and an inner area. The inner central part is called the nucleus. Now, the nuclear cataract is the most common type of cataract, beginning with a gradual hardening. There is a gradual hardening and yellowing of the central zone of the lens, which is also called the nucleus. And over the time, this hardening and yellowing will expand to other layers of the lens. Right. So the lens is actually, the outer part of the lens is called the cortex and the inner part is called the nucleus. When the hardening and opacification starts from the nucleus of the lens, that is from the center part, it is called the nuclear cataract. Next is the cortical cataract. Cortical means cortex, the outer side of the lens. The hardening or the opacification starts from the cortex of the lens and it comes inwards. So cortical cataract forms in the shell layer of the lens known as the cortex, and it gradually extends its spokes inwards from outside of the lens to the center. These fissures can cause the light that enters the eye to scatter and creating problems with blurred vision, glare, contrast, and depth perception. Okay, people with diabetes are at a higher risk of developing these types of cataracts. So, nuclear cataract starts from the center of the nucleus, the center of the lens, that is nucleus, and the cortical cataract starts from the shell of the lens, that is the outer coverage or the cortex, and then moves inwards. Okay, just the opposite. Next is the subcapsular cataract. Now, what is subcapsular cataract? The lens is basically held in a capsular bag. Now, this capsular bag, when it starts opacification from this part, it becomes subcapsular cataract. So, primarily affecting one's reading and night vision, this type of cataract begins at a small, opaque, or cloudy area on the posterior back surface of the lens. It is called subcapsular because it forms beneath the lens capsule, which is a small sac membrane that encloses the lens and holds it in its place. Okay. Next is congenital cataracts. These are the lens opacity which is present right from the birth. Congenital cataract may occur in a broad range of severity. In some cases, it could be visually insignificant, while in others, it can produce profound visual impairments. So, these are the four types of cataract: nuclear cataract, cortical cataract, then we have subcapsular cataract. That means the opacification starts just at the back of the lens, near or beneath the lens capsule where the bag holds the lens. Okay, and next is congenital cataract that is present from the birth. Okay, now what are the causes of cataract? The causes of cataract could be aging, that is called senile cataract, the most common cause. It could be secondary to any disease like diabetes, trauma or injury to the eye, systemic corticosteroids, prolonged exposure to ultraviolet light, smoking and alcohol consumption, and genetic predisposition. Okay. Next is, what are the symptoms of cataract? There could be a list of symptoms of cataract. The first one being blurred and hazy vision because of the opacification of the lens. Next is glare, difficulty seeing at night or in low light conditions, increased sensitivity to light and glare, double vision in one eye, fading or yellowing of the colors, frequent changes in eyeglass prescriptions or the power contact lenses, abnormal color perception, and decreased visual acuity. Next is the diagnosis of cataract. How is it diagnosed? Comprehensive eye examination has to be done, visual acuity test is done, slit lamp examination and dilated eye examination is properly done to diagnose cataract. Next is the treatment. The line of treatment, there are basically two major line of treatment. One is non-surgical approaches in the initial stages, and then when the non-surgical approaches cannot further treat the cataract, then we opt for surgical options, right? The non-surgical approaches are IVR prescriptions, strong reading glasses or magnifiers, increasing the amount of light to read, and certain lifestyle adjustments like if you are unable to see properly in low light or in night light, then you will avoid activities in the night time. So these are the small lifestyle adjustment that could be done in the initial stages of cataract. Now the surgical option is opted when no further the non-surgical options are helping. So the surgical option is phacoemulsification and the intraocular lens implantation, right? So the phacoemulsification and intraocular lens implantation in a simpler language is that the natural lens is coagulated, broken down and sucked outside, and then an artificial intraocular lens is implanted in its place in the posterior bag in the lens capsule. Okay, so the cataract surgery procedure, the entire procedure could be divided into three parts: pre, intra, and post operative phase. So, in the pre operative phase, what are the things to be done? First is appropriate history taking and physical examination of the patient, very important. All the patients are operated upon local anesthesia, so it is mostly done on an outpatient basis, right? The patient receives dilating eye drops. One type of dilation is mydretics, that is an alpha adrenergic agonist that produces pupillary dilation by contraction of the iris dilator muscle. Another type of the drug is cycloplegic, an anticholinergic agent that produces paralysis of accommodation, that is cycloplegia, by blocking the effect of acetylcholine on the ciliary body muscle. The cycloplegics like tropicamide produces ciliary dilation by blocking the effect of acetylcholine on this iris sphincter muscle. Now, the patient often receives anti-anxiety medications before local anesthesia injection. So, in the preoperative phase, in case of cataract surgery, is basically the patient's pupil has to be properly dilated. Otherwise, the proper access for phacoemulsification will not be there, will be prohibited. Okay, so proper dilation of the iris is very important. Proper dilation of the pupil is very important, and for that we are using two types of medications. One is mydretic, another is cycloplegic. Mydretic is an alpha adrenergic agonist that will help in the dilation of the pupil by contraction of its iris dilator muscle. And the cycloplegic are those which will result in cycloplegia by blocking the effects of acetylcholine on the ciliary body muscle. Okay. Now, often the patient is given anti-anxiety medications also before the local anesthesia injection. Okay. So this is the important points of preoperative phase. Next comes the intraoperative phase. So in the intraoperative phase, the anterior capsule is first opened, right? So the lens is actually, as we discussed, there's outside is cortex and inside is the nucleus. But even outside the cortex is a is a very thin, delicate capsule. The anterior part of the capsule is first peeled off as a small circular opening that through rexis. Now this anterior capsule is opened and then the access to the lens is gained, right? The lens, the nucleus and the cortex are removed, leaving the capsular bag. The posterior capsule bag has to be left intact. And in extracapsular extraction, the surgeon removes the lens nucleus by phacoemulsification. The lens nucleus is removed by phacoemulsification, in which the nucleus is first fragmented by ultrasonic vibrations and then aspirated from inside the capsular bag. In this entire process, the posterior capsule wall has to be maintained in its intact, unharmed position, right? The remaining cortex is aspirated with the help of irrigation and aspiration instrument. After this is all done, the intraocular lens is implanted in the capsular bag behind the iris. The larger incisions are closed with sutures while the smaller ones are left for self-healing after port hydrations. Now, after that, antibiotics and corticosteroids are administered and patient's eye is covered with a patch. So this is the entire intraoperative phase. The intraoperative phase begins with opening of the anterior capsule of the lens to gain an access, and then first the nucleus is fragmented and then it is taken out through phacoemulsification through extracapsular method, and then the cortex is aspirated through irrigation aspiration instrument, and after that the IOL is implanted in the nuclear in the posterior chamber lens, the lens bag. And after that the smaller incision are left for self-healing through port hydration, and the larger incisions are closed with sutures. That's it. Next is the post-surgery care. In the post-surgery phase, antibiotic drops are given to prevent infection. Corticosteroids are given to decrease post-operative inflammatory responses. Avoiding activities that might increase intraocular pressure like bending, coughing, or lifting is to be avoided. In post-operative examination, the surgeon measures visual acuity, anterior chamber depth, corneal clarity, and the intraocular pressure. After full recovery of the eye, the final prescription of glasses is then given to the patient. So this is the entire operative procedure: the pre, the intra, and then the post. Right. Next is the prevention of cataract. So there are certain ways through which cataract can be prevented to some extent: through regular eye checkups for early detection, wearing sunglasses with UV protection, eating a balanced diet which is rich in antioxidants, managing underlying health conditions, and quitting smoking and moderating the alcohol intake. So, the conclusion of this entire discussion is that cataract is one of the most common disorders which we find in ophthalmology OPD, and it's basically found in high prevalence in the older population, right? So, cataract is having two line of treatment: non-surgical and surgical. Surgical one being the most ultimate and the final solution to the patient, where the cloudy lens, the natural lens which has been opacified, is emulsified and removed, and in place of that an intraocular lens is placed in the capsular bag. So, in cataract, early intervention and treatment is opted for better outcomes. So this was the discussion. If you liked it, then subscribe to the channel and stay tuned. Thank you.